Hello, my name is Lori Arwood, and I'm the staff counselor at True Life Church. I have a master's degree in marriage and family therapy and a doctorate in Christian counseling, and I've been a licensed marriage and family therapist in the state of Tennessee for 20 years. I'm going to be speaking today about depression and the emotional toll that has been taken because of what we've been dealing with the coronavirus. So we've all experienced so many changes in the past few weeks. None of us have gone through this unaffected. Some of us have dealt with things that are smaller in nature, disruption in schedule. Some have been huge things, job loss, or even knowing someone who has been sick and who's been affected by the virus. And it's taken an emotional toll on everyone in one way or another. Those of us in the mental health field understand that we have not yet fully seen the repercussions of this issue with depression and other mental health issues. And so we know that depression is comprised of many, many different things, that it includes sadness, that it includes a sense of irritability or anger. We often don't think of anger being associated with depression, but it is. We know that there's a sense of emptiness or just exhaustion or sadness and hopelessness. And so we know that all those things make up depression. Now, with everything that we have been through with the coronavirus, all of us have felt some of those things sometimes. I don't think that anyone in our area or in our country has escaped through this without having some sort of emotion attached to it. But depression results when those feelings combine and when the aspects take root in a person and they stay with us for a long period of time, for 2 weeks or more, where you're feeling those things, all those emotions that we talked about on a daily basis, and the frequency increases and the intensity begins to increase. And then it begins to become overwhelming and debilitating. Depression then actually begins changing our brain chemistry, and it begins affecting us physically. Some of the things we may then start seeing physically is changes in appetite. You may feel that through this your appetite has increased and you just want to eat more, or you're craving more high sugar, high carb foods and what we call here comfort foods. And you may feel a sense that has gotten to a place that is abnormal for you. Or for some people, depression affects them with their appetite in that they lose their appetite. They begin to not enjoy food, or their taste buds even begin to change, where food no longer is desirable, or they just don't eat as much as normal and feel themselves pulling away from that. Another physical way that depression can impact us is through our sleep. And we will see that in the same way. Either it will change it to where you're wanting to sleep more, you're feeling completely exhausted, and even when you do sleep, your sleep is not restful. It's maybe broken to where you're able to fall asleep, but then you wake up several times during the night. Or you wake up and you're not able to fall back to sleep, and you lay there for hours, so you don't feel rested. Or we will see that there's just a complete lack of energy and wanting to get out of bed or wanting to make any effort, and your body just feels drained and zapped. So we will see it affect sleep in that way. And we can't discount the fact that even though we're talking about depression, that often depression is part of the grieving process. And whether we realize it or not, all of us are grieving in some way or another. Everyone has experienced loss in some way through the past few weeks and months, and may continue to experience losses. We've experienced losses in maybe jobs or economic status. We've experienced losses in routine and schedule. School children lost part of their school year and some normalcy. Some people, this is a milestone year for them. They may be a senior who had looked forward to graduating, or someone maybe was planning a wedding, or something else that was a big event in life has been postponed or changed or canceled altogether. And so from big things to small things, we've all lost something. We've lost our sense of safety and security, of knowing what's going to happen next. And so a lot of us are dealing with grieving. And grieving at first includes things like shock and denial, just like, I can't believe this is happening. And then we sort of move into bargaining, where it's, well, how can I make this different? How can I make this better? How can I change this? How can I make this not really the way that it is? And then sort of the other phase that's part of grieving is the sense of anger and depression, which, could be frustration and irritability, and then just an overall sadness for what we're experiencing. And so I think we cannot discount that some of the depression that we're feeling is part of that grieving process. And, I think one thing that would be helpful for you as an individual, or even you as a family, is maybe to have everyone write down or to think about the things that you feel like you have maybe lost or grieving during this time. And that's a way to deal with that, instead of just stuffing it down and reacting to it without realizing what's going on. So all of those things are going on. And secondly, another thing that can cause depression is stress. And I think that we all have to admit that during this time that there has been added stressors placed on us in our life. They've come in so many different ways, whether it's been that all of a sudden, as parents, you're having to figure out how to bring in income, or your job has moved to working at home, while at the same time you've been trying to manage your children being home, or suddenly being thrust into homeschooling, or just a complete disruption in routine. And the stress that's been brought on by finding toilet paper or getting groceries, or all of those things, can lead to a sense of depression and hopelessness. So when we couple that with the fact that we've all been more socially isolated, that some of the ways that we dealt with depression or stress or grieving in the past was to share that in our communities, was to share that in the community at work or at school or in our faith communities. And all of a sudden those things have been placed into categories where we're meeting with people at a distance, whether it's a physical distance of 6 feet apart, or it's just the distance of meeting together virtually with people. There has been a disconnect for all of us in some way socially, and that can lead to depression. So it is normal during these times to feel some distress. It's a normal human response to crisis or to the unprecedented times that we're living in, to feel some sadness or stress or grieving or loss or irritability, and a little bit sometimes of feeling hopeless, like, when is this going to end? How is this going to end? What's all this going to end up looking like? And so that is normal. What we're concerned about in the mental health field is for people when those lines begin to get crossed, but where it begins to become so distressing or so debilitating or overwhelming or all-consuming, that then it feels like that being able to overcome that gets harder and harder and harder. And so coupled with social isolation, we need to remember that there's 2 areas we need to look at with that to help manage and deal with depression, is support and structure. And so in this time when we are more physically separated, finding ways to get that support, that relational aspect with friends, with family, with community, with faith community, however you find that support, not completely cutting yourself off for that. And being able to still reach out and connect with people and share what you're feeling and not keep everything inside. We see that depression grows and becomes more overwhelming the more isolated we are relationally. So even though we cannot be together in all the ways we want to physically, we can still find ways to reach out to people and not be isolated relationally. And so finding support that you need to cope with depression. The next is structure. We know that structure centers around a sense of predictability. Well, our times lately have been anything but predictable. There was a time when all this first started when almost every day we were faced with a new reality or new information or restrictions were changing. And now as we begin phasing into different phases, it will again become unpredictable in ways that we cannot control. And so what we have to see is the ways that we can add predictability into our lives through rest, through sleep, staying hydrated, our diet, getting some daily exercise. Exercise actually releases serotonin in the brain, which is what depression and medications that treat that, those are medications that try to increase serotonin levels. Exercise does that naturally. Research tells us that 30 minutes of cardiovascular exercise a day is equivalent to taking a low-dose antidepressant. It has the same effects in your brain. So that's something you can do. Getting vitamin D, being outside. Another thing that helps with the feeling of being out of control or sadness or irritability, we have found is limiting screen time. Limiting exposure to the news. And so we need to stay informed during these times. It's very important to do that, but we don't need to stay informed to the point that we become overwhelmed and that we are just inundated constantly with information that begins affecting us emotionally. Developing a routine is very important. And what we need to realize that if you feel like that you are struggling with depression to a level that has slipped out of sort of a normal range of emotion during this time and thought during this time, that it's very important to reach out to a mental health practitioner. Most, if not all, of the mental health practitioners in our area are still working under these conditions. They're still meeting through telehealth. Our mental health centers are still open, and so you can call those numbers for that local mental health center or counseling center and ask how you can speak to someone who's trained to help you with depression. You can speak to your primary care doctor who can maybe steer you to people and in the right direction for that. Through means that are acceptable through social distancing. And if you begin to feel completely overwhelmed and you're having thoughts of harming yourself, because we also know, unfortunately, during this time that we have seen suicide rates increase during the past 6 weeks. We know that on a national level and on a local level. And so what we need to know is that reaching out for help, there is a national suicide hotline that you can call anytime, 24 hours a day, and it's 1-800-273-8255. And so you can call that number. You can call your local emergency room and they can instruct you what to do about that. But please do not stay isolated. Please reach out to people. Please know that even though this is a very, very difficult time and it's a very overwhelming time, that there are still people out there who care about you, that you can reach out to, and who you can find help with depression. And so I would encourage you to do that. Thank you so much and have a great day.